Good evening, everyone. I think we are going to get started in a minute. Teresa, would you like to start with welcome?
Yes, thank you. Hello, everyone, and welcome to our webinar series, Candid Conversations of Health. Throughout the year, we will tackle a variety of topics related to our health and wellness. The focus of today's webinar is cervical cancer awareness. My name is Teresa Hudson, and I'm the Health Equity Coordinator for the Louisiana Department of Health's Bureau of Community Partnerships and Health Equity. The Bureau of Community Partnerships and Health Equity is devoted to increasing the citizens of Louisiana's knowledge about what affects our health, especially for those in particularly vulnerable communities and populations. This devotion is rooted in raising awareness through webinars like today's and partnering with stakeholders in the community to move forward to a healthier Louisiana. At this time, it is my honor to introduce Dr. Courtney Phillips, Secretary of the Louisiana Department of Health, who will share a few welcoming words. Dr. Phillips.
Did we lose Dr. Phillips? Can we check on the panelist list?
Yeah, no, she's here. I think she's muted. Dr. Phillips, I believe you're muted. Dr. Phillips, I think you're muted.
I'm sorry, y'all. Give us 1 second.
Joys of Zoom.
Dr. Phillips, do you hear us? There we go.
Yeah, can you hear us?
Okay.
You should.
Can you go in the chat and email, and I will go on with my introduction?
Sure, yes. Go ahead.
Just let me know when we get her, because we want to make sure she gets her introduction in. We want to make sure we hear from Dr. Phillips. Thanks.
Of course. Yes, if you want to take over the overview and that part, I will get this figured out.
Sure. So while we are troubleshooting that, I want to make sure I give you a message. Medicaid if your medical insurance coverage or someone that you know has medical insurance coverage from Medicaid, that you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid and you could lose your health insurance coverage. To update your important information, you can visit the self-service portal at https://mymedicaid.la.gov. Once again, that's mymedicaid.la.gov. Or you can call 1-888-342-6207. Let's see if we can get Dr. Phillips back on. Thank you for adding that in the chat. We appreciate you. And can we unmute Dr. Phillips from our end? She's having the audio problem saying that the webinar doesn't have her unmuted.
Okay, sure. Let's see. Oh. It's not able to unmute her from our end. It's just saying that she needs to unmute. Okay.
Okay.
Hold on.
There we go.
Mhm.
Also, make Ms. Joyner a co-host as well, please.
Yes. I am doing that. That should give them all the abilities to do what they need to do.
Okay, great.
Yeah, that's true. So yeah, they both have co-host privileges. Just let me know in the chat if there are any other issues. And I can circle back. In the meantime, I'll go over the overview of the webinar really quickly. So first, once we get through the intro and the welcomes, I'll go through the walk through the facts of the cervical cancer awareness. Then we'll have our great panel discussion. And at the end, I'll review the key takeaways and also share some resources for everyone to take home. Are we, Dr. Phillips, are we any closer over on your side? I'm not hearing anything from her or seeing anything in the chat. So I'll review the key facts for now. So facts. So information, firstly, is it's important to get up-to-date and accurate information from credible sources related to cervical cancer. Second, screening. All women are at risk for cervical cancer. However, it occurs most often in women over age 30. Screening should still begin at age 21 unless otherwise specified. Third, prevention. Understanding what cervical cancer is and the screening recommendations and risk factors associated with cervical cancer is very important. And lastly, early detection saves lives. These 4 facts are ones you'll hear throughout the webinar. I want to stress the importance of getting information from trustworthy sources. So if you're going to share cervical cancer awareness information with loved ones or within your communities, please use only information coming from websites like LDH, CDC, or the American Cancer Society, or similar organizations. We will provide you with a one-pager via email after the session to aid you in how to share cervical cancer information. Sharing accurate info can help save lives. And now it is my pleasure to introduce the Director of the Bureau of Community Partnerships and Health Equity, Devontra Brown.
Hi, can everyone hear me?
Yes, we can hear
All
you.
right, great. So we are still taking care of those troubles, but we'll get there soon. Thank you so much, Ms. Huston, and thank you all for joining our Candid Conversation on Health Cervical Cancer Awareness webinar. Dr. Sanjay Genesia. Dr. Genesia is a triple board certified hematologist and medical oncologist, serving as Chief of Oncology Service at Baton Rouge General Hospital and a founding medical partner of Doctopedia.com, where he serves as Chief Medical Officer of the Oncology Channel. Dr. Genesia is a social media educator and medical influencer with 500,000 followers, known as the Onc Doc, and has been featured by the Washington Post, dozens of national podcasts and regional news channels, and has partnered with national marketing offices for the American Cancer Society and more. He is extremely proud to represent his home state of Louisiana in these endeavors and is deeply grateful for his community enabling him to do so. So with that, let's get ready to have a discussion. Please take it away, Dr. Genesia.
Thank you so much, Secretary Phillips, Mrs. Brown, and Ms. Hudson for being here and sharing the sentiment on the slides for starting today's event. For everyone here, community members, stakeholders, y'all took the time out of your busy schedules to attend this important discussion. And I'm always just really humbled and honored to be with people that really, are just seeking education and are leaders in the community so they can share that stuff. So it's something I'm just extremely proud of and humbled. So I appreciate you being here. And this webinar, our hope is that what you hear and learn, you not only can guide your own health, but find really useful, empowering, and can encourage others, because they have very significant, not consequences, but can make spare life from being debilitating with, something as scary as cancer. So we want you as the audience to leave this conversation empowered with, the knowledge of signs and symptoms and why we do things in medicine and how we got to seeing if it makes sense and how it can benefit you and your loved ones in the future, as well as some of the risk factors with cervical cancer, and kind of how and why you do screening and what the goals are and why it's really just beneficial to do, because when things are recommended, they're covered by insurance, they're standard of care, and hopefully we can get this knowledge out there. So we have what we like to call trusted gatekeepers from all around the state. And I'm super excited about this team and honored to be able to be a part of the panel who will lead and be part of this discussion. And it's a real treat for myself and everyone here to be able to learn from you all. So before we get into the education piece, I would really like to do a brief introduction, just so I'm sure you'll be as excited as I am. First, it's Dr. Denise Linton. She's a fellow of the American Association of Nurse Practitioners, has 35 years combined experience as a registered nurse and family nurse practitioner. She obtained a Master's of Science in Nursing and Family Nurse Practitioner Certificate from Columbia University and a Doctor of Nursing Science from LSU Health Sciences Center, New Orleans. She is the leader of National Cervical Cancer Coalition, Lafayette, Louisiana chapter, which is really exciting. And in this role, she increases basically the awareness about cervical cancer prevention, because as you'll learn, any opportunity you get to prevent cancer is a very, obviously exciting one, especially when the data is so good. So spoiler alert. And she is also an author, a researcher, and an international speaker. So we're super excited to have her. And then second, we have Miaja Mack. She is a gynecologic gyn-onc is what we usually say, gynecology, oncology nurse practitioner at Women's Hospital in Baton Rouge. She received her Bachelor of Science in Nursing from Southern University A&M College in Baton Rouge in 2013 and completed a Master of Science in Nursing with a concentration in family nurse as a family nurse practitioner in 2017 from Southern University. So like myself, very heavily Louisiana trained and proud of it. She is certified through the American Academy of Nurse Practitioners, and she's a certified personal trainer through the National Federation of Personal Trainers. She has obviously a passion of health and wellness, both in a physical level as well as with knowledge and medical care. Then we have Miss Erica Crawford, and she's a Baton Rouge native, like myself and many of us here, who has 20 plus years of experience as a medical health professional. She has worked in various areas of service, from primary care to occupational medicine and even the emergency medicine. She is currently working as a certified patient navigator for St. Gabriel Health Clinic by helping women to prevent unnecessary disease or preventable disease, disability, or premature death due to cancer. She also manages community health navigators in order to target social and non-medical interventions to improve patients' health and their social determinant needs, which is very important, particularly in Louisiana. This provides a wide array of age-appropriate services to support and maximize a patient's ability to really access, which is really a big thing, and I think Louisiana's done a great job of improving, as well as maintaining that health when they're able to access it. And then we have a good buddy of mine, old friend, Dr. Evan Smith. He is a gynecologic oncologist, again, we say usually gyn-onc, at Women's Hospital in Baton Rouge, Louisiana. He is an Opelousas area native and earned his bachelor's degree in biology at LSU, same year that I did, and received his medical degree as well at LSU Shreveport, and we were privileged to be in the same class together there. He completed residency in OBGYN at Oxford Medical Center in New Orleans before moving to New York City and doing his fellowship training at Memorial Sloan Kettering Cancer Center. And for those of you that don't know, they're exceptional, arguably the #1 place for female-related malignancies like gyn-onc and breast cancer. He just recently moved back, and he's a member of the Society for Gynecologic Oncology and the American Congress of Obstetricians and Gynecologists. So Now, I hope you can really appreciate how exciting and how much wealth of knowledge there is between all of these different fields. It's like Venn diagram where they all overlap with cancer awareness, but have obviously collateral education that hopefully they can share and that we all get to be a part of. So saying this part of this discussion will be factual and based on science and understanding. It's not that of opinion, and that's where kind of all the studying and learning comes in to get those certifications that I've listed, and that's not even all of them for this exceptional panel. But let me be the first to say, as the moderator of this session, that people have a right to feel what they feel regarding their past and present experiences, especially when it relates to things like racism, sexism, mistreatment, injustice. We know these experiences play a part in people, populations, communities, both now and today, as well as the trust in their healthcare system as a consequence of the past. It's one time I heard a phrase where somebody said, well, some people don't trust the healthcare education they should, and somebody said, no, like we should earn their trust back, because there is very well evidenced disparities and things that have been in the past that I'm very proud of Louisiana for writing and being very active. So with that said, let's get this panel discussion started. I'm going to ask around questions kind of particularly, and try to cover all the areas that I know are popular questions that I see as kind of a medical oncologist in treating patients. So the first one, and I'm just gonna maybe start with Dr. Evan, sorry, I call him Evan, and let everyone answer. And that's basically just overall, what is cervical cancer and how is a Pap smear or screening or an HPV vaccine relating to cervical cancer? Like, how does that even kind of group together? So Dr. Smith, I'll let you say, what is cervical cancer?
Yeah, sure. Cervical cancer is something I unfortunately see too much of in my clinic. It's a malignant tumor that starts on the cervix, and it has the potential to then start to invade other tissues around the cervix. So when it's at its earliest stages, it's best because we can treat it most easily, but left untreated, it has the potential to metastasize. So very basically, that's cervical cancer in a quick snapshot.
Yeah, and so like any cancer, it's a population of cells that have gone rogue. They were your normal cells, and now they're wanting to grow and not listen to the body. And the scariest thing is if they leave, right? So they metastasize. So that's cervical cancer. That's where it's located. Dr. Linton, what are some various methods that we can use to screen to see if somebody either has, or more importantly, and most ideally, has a high risk of having cervical cancer and not there yet? Oh, forgive me. I think you're there.
Sorry about that. So generally speaking, if you have a cervix and you are between 21 and 29 years of age, you need to obtain a Pap test every 3 years. If you are between 30 and 65, you need to have what we call co-testing, which is your Pap test and your human papillomavirus test. And then there's a standalone test, which is the human papillomavirus test. As you can see, I have a very strong Jamaican accent. I've been in Louisiana for 20 years, so I think I can call myself a Louisianan right now.
Oh, I think you definitely qualify. So that's what you're doing with the Pap smear. You're looking for it, right? So I'll ask Ms. Mack, do I really need a Pap smear if I don't have any symptoms? Like if I'm just, no bleeding, pain, no nothing, then do I need a Pap smear to really see if I'm at a risk for it?
Absolutely, absolutely. We highly recommend PAPs in any woman who still has a cervix in place. Many people present with cervical cancer and they've never had any symptoms. They may have never had that abnormal vaginal bleeding. So that does happen. So any woman who has a cervix should see a GYN and they should have a Pap test done.
Yeah, so I think that's the big thing is like when I said ideally, we want to catch something way before it causes symptoms, right? And if you're getting it every 3 years and you're totally clear, we know statistically it's just less likely to have a cancer within 3 years. But if you can catch it early, which is the highest chance of cure, 90+%, they often won't have symptoms, and that's what you're looking for. So to see if you can get it before it even causes a problem, let alone spread somewhere. So, Ms. Crawford, can you tell me, as a patient navigator, so a lot of times, unfortunately, with healthcare, things are getting very like fragmented, right? It's not kind of a catch-all like you used to have. Then that can be very, stressful, but even frustrating for patients. Well, I got to go here for this and here for that. What is the role of a patient navigator, and what does it provide both, the clinicians, but especially the patients?
So a patient navigator generally is a person who guides a patient through the continuum of care, from the start of screening to education to eliminating any and all barriers the patient may have to getting access to care. So a patient navigator will be there for not only just the beginning of screening and education, to guide the patient to their next step, to make sure they get their screening and understand what that screening is and know their next steps so they can make an informed decision about their health care.
That is very helpful because everything's a multi-step process, right? You have the physician doing the Pap Smear or NP, and but then it has to go to a pathologist, and then you have to wait on the results, and then based on what the results are, if it's clear, it's clear. If there's some cells that I hate to use the word sketchy, but I do, but they're not cancer, then there's a series of steps that happen, and depending on how abnormal, it involves different things, and that's where the patient navigator is really the glue to everything, because they're able to make sure all that stuff is coordinated and you're not left in the dark. And that's why it's really important, if anyone in any part of healthcare, you should always call if you haven't heard and you have any concerns. Again, the healthcare system as a whole is suboptimal, and we're all working hard to make it optimal. So be your biggest advocate, right? So, Dr. Smith, I hear this a lot, when we talk about screening and kind of, well, have you gotten your colonoscopies or your mammograms? I'll get the answer sometimes that says, oh, well, I'm at low risk. I don't have a history of it. None of my family members had a history of cancer. How big of a role does genetics play into having cervical cancer versus things that are non-genetic that may happen in your lifetime?
Yeah, so unlike some of the other GYN malignancies like ovarian or uterine cancer, cervical cancer is not motivated by genetics at all. It's almost always motivated by an HPV infection that essentially goes rogue and starts to cause some of the cervical cells to become abnormal and then eventually cancer. Genetics really does not play a role in the development of cervical cancer. So not having a family history should not make you not want to get a Pap smear.
And so on that point, Dr. Linton, you mentioned HPV, right? What does HPV stand for? What is it about that, that contributes to cervical cancer? What percent of cervical cancer is caused by that? Because Dr. Smith is telling me that it's a pretty important thing. And how do we get HPV, and is there any way to prevent it?
Okay, so HPV stands for human papillomavirus, and there are actually more than 100 types of human papillomaviruses. And however, there are some that we are specifically concerned about when it comes onto cervical cancer. So approximately 70% of cervical cancer, they are caused by persistent infection. So it is not if you get infected with the HPV virus that you have cancer. It has to remain there for years, and then the cells have to undergo changes. Then if you do not get screened, then they continue to become horrible and evolve into cancer. So more than 70% of cervical cancer cases are caused by types 16 and 18. And there are also other iris types that together, they account for approximately 90% of all cases of cervical cancer. And the other types include type 31, 33, 45, 52, 58, and so on. So a lot of times women tend to get embarrassed because we know that the HPV virus is passed on through sexual contact with somebody. But I just want you to know that it does not have to be the complete act of having sex. If you come in contact with the genitals at all, or depending on the type of sex that you have, then it's possible that you can actually pass on the HPV virus from one person to the other.
So 90% of cervical cancer is from this human papillomavirus. That's very remarkable. And it, again, it's not like herpes where you see lesions, right? You could just, most people have no idea that they have it, and it's just festering and festering. Ms. Mack, it would be really nice if there was a way to reduce the chance of getting this HPV infection, because I hear it's super common and, you know, doesn't take many partners at all to have a very high risk of getting it just because it's so communicable. Is there a way to be able to prevent getting these scary strains of HPV?
The Gardasil vaccine is what we highly recommend. So you can get it starting around age 9. And previously it would only go up to age 26, but recently they've extended it to age 45. So we do highly recommend the Gardasil vaccine. And then also just using protection. That's super important.
So there is a vaccine that can prevent you from getting the high risk ones that we know are kind of more incriminated in cervical cancer. And then certainly, especially with everything going on, people want to be educated, and that's incredible. If vaccination is not something that someone elects for, it's very, very important to use barrier protection. That's very good to know. And, you know, I'll bring up a point from the med-onc. There's not many things that you have that are 90% causative for something that you can prevent, and hepatitis is another one, right? So we get hepatitis vaccines. Those are two kind of wins, because we know both HPV and hepatitis cause obviously liver cancer and cervical cancer, and here's a way to be able to vaccine against it to significantly reduce your chance of that being the cause. So, you know, cancer, well, healthcare in general is very debilitating in cost, but especially cancer-related diagnoses. Ms. Crawford, are there costs associated with screening for cervical cancer or receiving these vaccines? Because, you know, costs just seem to be getting higher in healthcare. And maybe can you talk about what those costs look like compared to actually having cervical cancer and treating cervical cancer?
So in Louisiana, we have this beautiful program called Louisiana Breast and Cervical Health Program, where patients who are uninsured or underinsured can have a screening done for low to no cost. All they have to qualify, but they have to be about 250% below the federal poverty line, which most people qualify for. So you can go to a local FQHC, which is where I work currently, and get screened for free. And they will screen anybody regardless of their ability to pay for the visit. So you can essentially have this screening done for free at your local community health center. So there's no cost associated with being signed up for that program or being in that program. And while in that program, you get the Pap screening and the HPV screening after age 30, and you get navigation services as well.
And are you familiar with somewhat, I hear the costs of actually treating cervical cancer, you know, should that happen, are significantly higher, right?
Yes, so what we do is a warm handoff to LSU Clinic at Women's Hospital with our patients, so they can continue treatment, as well as help them enroll in a Medicaid program where they can have some of those costs that are associated with cervical screenings taken care of, as well as find other resources for those patients to have, you know, their cancer services taken care of.
Yeah. And that's why, you know, it's almost like cost prevention too, because with actually having cervical cancer, God forbid, you know, metastatic, until we find a better system, the healthcare costs can be extremely debilitating. But to pause for a second, there is a question in the chat that is a good one. If there's a history of an abnormal or multiple abnormal Pap smears with mild dysplasia, do you still wait every 3 years to have a Pap smear, or do you kind of call the doctor back and say, hey, do I need some more? Or do they usually guide you on what to do next? I'll punt that to Dr. Smith.
Yeah, sure. So it sort of depends. If it's just mild dysplasia, it's very likely that you shouldn't wait another 3 years to get screened, but just 1 year from the point of the prior screening. And that sort of varies if HPV testing was done along with the Pap smear test, because those two pieces of information can be taken together and come up with a good algorithm for when you should be screened with a Pap smear and our HPV test again. But you know, if you have a history of mild dysplasia, if you have a history of severe dysplasia, you shouldn't just push it aside and wait 3 years. You should be in touch with your gynecologist or your healthcare provider and stay proactive and really ask them when should you be screened again.
And how does the term dysplasia kind of relate to the term of ascus?
I mean, I would consider dysplasia a sort of precancerous state. And so sometimes your Pap smear your doctor may say ascus, and you think, what is that? It's just atypical squamous cells of undetermined significance. So they're a little different. Ascus with a positive HPV test, if it's a high risk HPV type, should not be ignored. Mild and certainly severe dysplasia should be given more attention to. It may possibly mean getting a colposcopy, which is a look at the cervix under the microscope, and or even a biopsy of the cervix to really kind of determine what's going on.
So ascus is the least, it's the least thing from normal. It's there's something, but it's the least. And then when you get to the dysplasia, that's the DYS word, dysplasia. If you see that in a report, that's where you really want to make sure, if you hadn't followed up with a provider, that you do. Okay, very good.
And I would also like to add, I think it's important to know that, excuse me, even if you aren't getting that Pap test every year, it's still important to go and get that visit, because sometimes abnormalities can be seen. So even if they aren't collecting cells, they're still looking at the cervix, and sometimes they can actually see abnormalities and something can still be caught very early. So even if you're repeating that Pap every 3 years, you should still go annually for that pelvic exam.
I have something to add as well. So it's very important that you realize that the manner in which abnormal Pap test results are treated, that is very individualized. The organization that tells us how to treat people with abnormal Pap tests, they came out with new guidelines, and it is highly individualized based on your risk factors. So they take your history into consideration and a lot of other factors. So you cannot say to your friend, okay, so I have what you have, so this is what they will be doing for me. It will be specific to you regarding your history of abnormal results and a lot of other factors. So remember that too.
Yeah. So the important thing, it sounds like, if it's not normal and you haven't heard or followed up from a physician, it's definitely worth calling to at least see, hey, is it appropriate that I'm not, coming back sooner than the 3-year mark? So how long, and I'll toss this up for anybody, what is we talked about the HPV, and forgive me if you said it, when does that HPV vaccine start? And what's the oldest you can be before getting the HPV vaccine? I mean, before no longer being able to get the HPV vaccine. Ms. Mack, Ms. Crawford, go for it.
So I'll go for it. So the youngest with Gardasil is Gardasil 9 years old, and the oldest you can be, I think, is about 45. Am I right, Doc? We usually see about 11 to 12-year-olds come in for the series of Gardasil. I think they do 2 doses when you're about 9 to 14 and 3 doses when you're at 15. You have to do the 3 doses. And I think the second dose is 2 months after the first dose, and the third dose is 6 months after that.
Perfect. And okay, so upper limits of 45. And one question, especially if anyone's listening to this and they've had whatever, ascus, dysplasia, problems like that, but somehow they had not gotten the HPV vaccine yet. Is there a role to get the vaccine if you've already even found HPV on your Pap smear?
Dr. Sanjay, Dr. Genesia, can you repeat that one more time? If you've already had HPV found, is there still a role of getting the HPV vaccine?
Correct. Like, the question is, well, should I get Gardasil now if I already have it? I already have some scales that are, show dysplasia.
It is a good idea. If you're in the age group where the HPV vaccine is approved by the CDC, it is nice to get it because the HPV vaccine protects against 9 strains of the HPV virus. Dr. Linton mentioned that there's over 100 of strains. The 9 that are included in the Gardasil vaccine are the ones that we know are most commonly the culprits or the causes of cells going from normal to abnormal to cervical cancer. And so you may have had an HPV infection with one of those strains, but the HPV vaccine will help you be protected against other strains that you may not have been exposed to before.
That makes sense. And so Dr. Linton, somebody did ask in the chat, it's a great question. And I think we talked about the theory, and you had mentioned, or somebody had mentioned about it needing to be there a long time to kind of fester and cause problems. What is the thought on why that 45 age is the cutoff? Is it the amount of, I guess, sexual activity and the number of partners? Is it because at that point, the duration that it takes to see abnormal cells? Is it a combination of all of it?
This is going to sound very simple, but it is actually the people who it was studied in. So remember that for things to receive FDA approval, for vaccines to receive FDA approval, there are actually clinical trials that take place in certain age groups. So in the beginning, I think it was up until 21 years of age for men and 26 for females or something like that. So it became so effective that they decided that what they would then do, since older folks are getting cervical cancer, is to actually test it among those women, those people with cervix up until 45 years of age, to see whether it would be efficacious in this group of people or be effective in this group. So that is one of the reasons that they actually went to 45 years of age. So everything that we're saying here is on the record and it's based on science. So I won't get into whether people are older are actually getting it.
Right. I mean, it's worth noting that I think the average, age of diagnosis is around 50 years old. And I think 1 out of 5, 20%, still get it at the age of 65. So, reasonably, and as people live longer, it's something that makes sense if it's preventable to prevent. Ms. Mack, when we talk about different kind of subgroups, and this is and I'm kind of proud of it, on social media there's a lot of kind of movements about kind of bringing attention to equity and kind of disparities in different populations. Is there a kind of slant or a disproportion on the incidence or the amount of death in Black women and women of color as far as their risk of cervical cancer, or the rate of kind of death or advanced complication?
Yeah, so Black women and women of color are not necessarily at an increased risk of cervical cancer, like Dr. Smith mentioned before, because of some inherent or hereditary component. The racial and ethnic disparities in healthcare does put them at an increased risk. Unfortunately, Black women do not undergo routine screening at the same rate as white women. This could be due to socioeconomic status. This could be due to kind of some general distrust in healthcare providers. Also, it could be due to lack of access to healthcare for Black women. So many times when we see Black women, they already have cervical cancer, so we may not do prevention in this population. It may be actual treatment of cervical cancer.
Okay, that's very helpful. And Ms. Crawford, you'd mentioned, I'm just going to circle back. So people that do have difficulty to access, what's the first step? They can't just walk to a door. Where do they contact? What do they do to say, hey, I haven't had one, I'm 30 years old, I'm 35, and I'd really like to know, what can someone do that may have difficulty getting kind of regular access to care?
So the first thing is walking into their healthcare facility, or just simply going online to LBCHP website and doing what they call as a referral form, because there are several locations that do this breast and cervical health program, and all they have to do is fill that information out. They will route those patients to the nearest appropriate facility where they can have a screening done. And once they're routed to one of those facilities, most of them have patient navigators who will help them with their next step and guide them through the screening and testing process, and also give them a warm handoff to the next facility if that's what the patient may need.
Gotcha. And we kind of talked about it before, but to highlight that and getting it done earlier, Dr. Smith, you know, do you have some kind of, I guess, rough statistics on what survival is like if you catch it, even if you have, you know, full-blown cancer? So by that, we usually mean when you see the word invasive or carcinoma, that's where you're saying, okay, now I'm going to go talk about staging. What does it look like as far as, you know, cure rates? When we say 5-year survival, we don't mean the 5-year survival as in they live 5 years. That means how many are alive in 5 years and hopefully presumably cured forever. What does it look like for like a stage 1 early versus more of an advanced that's not metastatic or stage 4 and gone somewhere else, but a stage 3, which just means it's more advanced and a high risk that it went somewhere? What do those numbers look like kind of, you know, at the 5-year mark or ability to be able to cure it?
Yeah, sure. I think you touched on this a little bit earlier, but when cervical cancer is caught at an earlier stage, our ability to cure it is so much higher, and it makes achieving a cure a lot easier. Patients with cervical cancer, when it's early, kind of fall into 2 categories. It could be treated surgically, where we surgically excise the tumor, or they can undergo chemotherapy and radiation for treatment. Both work very well when it's an early stage. And stage 1 cervical cancers have a 5-year survival rate at about 90% or higher. So, you know, 90% of patients that are diagnosed with an early stage cervical cancer are still alive 5 years out from their diagnosis. When it becomes more locally advanced, it's not that it can't be treated, but it becomes a little bit tougher to achieve a long-term cure of that cancer. And so the recurrence rates go up a little bit. So patients with locally advanced cervical cancers, 5 years out, probably about 60 to 70% of them are alive. And that's because the other 20 to 30% have had a recurrence and may have unfortunately led to their death. So.
Okay, so catching it early again is very important. Miss Mack, we didn't, you know, I assume everyone knows this, but I know in med school even, I had to learn a little anatomy better. What is the role of like patients that have hysterectomies? Do they need cervical cancer screening of any kind?
So if you've had a hysterectomy, of course, you're removing the uterus and the cervix. If you have a history of HPV, abnormal Paps, then we do recommend continuing to get screening. If you've never had a history of HPV, you've never had an abnormal Pap, and you have your cervix removed, we still recommend that pelvic exam, but you may not need a Pap test.
Perfect. And what is the purpose of that pelvic exam?
So we're going to look at the vulva, the outside of the vagina. You're going to look at the vulva because you can, of course, have a vulva cancer or an abnormal lesion on the vulva. And that's important to say because HPV also causes abnormalities on the vulva. So we're going to look at the vulva. We're also going to look at the vagina, and we're also going to feel in the pelvis just to make sure we don't feel any lumps, bumps, abnormalities, tumors, that sort of thing.
Perfect. So it's important, you know, again, I had to learn everything from basics when I did my medical education. Hysterectomy, it can satisfy most of the purposes of like cervical cancer in the cervix, uterine cancer, but then there's all kinds of things that we know are associated with vulvar cancers and another gynecologic that's different than ovarian cancer. Unless you had your ovaries removed, you know, there's no good screening mechanism outside of pelvic exams for that. And the whole concept of all these screens, and Dr. Linton, maybe you can touch on this, like how common is cervical cancer? It's not, so that, you know, a lot of people have a fear of going in and the chances of it are being pretty low. The flip side is catching something before and early, just like any of these exams that we're talking about, is so huge, because then you have the peace of mind that, hey, everything looked good. Chances are in 3 years I shouldn't be at high risk if everything was normal. So can you talk about really I guess compared to other cancers nationally or especially in Louisiana, is it a high risk thing? And I only say that to say I hope people are encouraged to say, you know, it's not nearly the incidence of breast cancer, but it's the peace of mind that's invaluable and avoiding something that could be really bad.
And I'm happy that you related it to breast cancer, because all of us who are here as panelists, we have a passion for preventing cervical cancer because it's preventable. I talk, breathe, sleep cervical cancer prevention. So that is one of the reasons we are here. Nobody should actually die from cervical cancer. And coming from a developing country to a first world country, where according to the American Cancer Society, approximately 4,000 women die each year from a cancer that's preventable. I did not say 400 or 40, I said 4,000. And over 13,000 are diagnosed with cervical cancer. And then we think about having the vaccine, which is your primary prevention. And then we have your Pap test, which includes your HPV test that actually tells us for sure whether or not you have abnormalities. So nobody really should be having cervical cancer. So that's like my kind of soapbox right here. And I know that in the long run, the treatment for cervical cancer is more expensive, but why wouldn't you focus on preventing something that you can prevent? And then in the South, we are up there. We are the first 5 or third or somewhere with regard to cervical cancer incidence and mortality. So we're pretty badly off. So we're here in January to increase awareness about this cancer, but we don't want you to forget about it. We want you to hear our voices in your head saying, go to your healthcare provider to get yourself taken care of. I know that a lot of times you live in the rural areas, it's hard for transportation, and there are other factors, but as our navigator said, Ms. Crawford, there are people there who can help you to get to where you need to go. Did I answer your question?
No, you nailed it. I mean, we're 6th in the country with the highest, problem with cervical cancer. And, everyone's terrified of pancreatic cancer for good reason, right? Like I lost my grandmother to it. It's scary. There's no screening. And if somebody said there's a vaccine that reduce your chance of ever having pancreatic cancer by 90%, or like 90% of it will be prevented, that's incriminated. And there's something we can do to kind of check to see if you have a lesion, because the reason of pancreatic and lung have such high mortality is because there's no symptoms for a while, right? So those are challenging, but if we offered that, I'm sure everyone would go running. The same concept applies for cervical cancer, and there's not many yet that we can make truly preventable. Ms. Crawford, do you have any other points on that kind of access in rural areas and transport? Are there things offered by centers in town or around that either are mobile or satellite, or can kind of help facilitate those segues to be able to get their screenings?
So in most rural areas, you have your local community health center that can do your basic Pap screenings or HPV screenings. In most rural areas, most of them don't have colposcopy clinics, so they'll probably be routed to a bigger facility like in Baton Rouge, that would be Women's Hospital. But most areas, you can get a general screening, a general Pap test, a general HPV test, and that's generally my job as a navigator, to find the patient access to care, whether it being finding that patient a ride, finding the nearest bus route, or using Uber Health or Go Grandparents, just finding ways to get patients in to be screened. So, things like that are not a barrier for them to go and have just a general screening.
Yeah. Dr. Smith, that's male, that's not in gynonc. Some things, and I have this with the patients sometimes, like mammograms can be uncomfortable and colonoscopies can just not be a good thought as far as drinking a bunch of stuff to have to, clean out your bowels and then have the scope. What is happening? What is the Pap smear? Is it a biopsy? Is it needle? Is it, what does it involve exactly?
Yeah, so a Pap test thankfully does not require a colon prep like a colonoscopy would. It's simply a visit with your gynecologist. We use a speculum, which is that you often see the metal shaped device. It looks like a duckbill almost that opens up. The speculum goes into the vagina. We visualize the cervix, and we actually take a brush to take a sampling of the surface of the cervix to collect a few cells there. That sampling is sent off to pathologists. They essentially spin things down to make it easy to see under a microscope, and they look at those cells under the microscope to see if they look totally normal, or if they look a little bit abnormal, or if they look very abnormal, and we get a report back.
Okay, so you're just brushing a sample literally in the area and then sending it off. It doesn't take an actual biopsy, and it's not common to see bleeding afterwards or pain.
You may have a little bit of spotting. That's not totally uncommon, but you should not, it shouldn't be very uncomfortable. It should be quick, and it just requires a few minutes with your gynecologist or primary care physician.
Okay. So Ms. Mack, we talked about multiple times the screening part. What would you see if something was more advanced and you haven't been able to get, a Pap smear yet? And how does it differ, or is there anything I should look for if I'm premenopausal or postmenopausal as far as the symptoms of something like cervical cancer that's more advanced?
Yeah, so the biggest symptom of cervical cancer would be abnormal vaginal bleeding, right? So in a postmenopausal patient, then of course any bleeding is abnormal. If you've gone through menopause, if you've gone a full year without having a menstrual cycle, then any bleeding is abnormal. You need to notify your healthcare provider. In other women who are still menstruating, they may notice that their cycle is heavier, their cycle is longer, maybe they're having some bleeding or spotting in between their period. They may have pain with intercourse, they may have bleeding after intercourse, or they may have a persistent discharge. Those are all symptoms that they should notify their provider about.
Okay. So not hereditary. It seems like it's way more about something that you get in your lifetime. So HPV is most incriminated and constitutes 90% of it. And there's a vaccine to be able to prevent the high risk ones. Has a great survival rate if you catch it early. And that's where those intervals are kind of designed to see what period of time do we feel pretty good about something else not coming up. And most are asymptomatic at an early stage, it sounds like. And it's really after, when it's a little more advanced, that you can have kind of bleeding symptoms, but no reason not to go in, because it can still be curable, obviously, and going in sooner than later is important. And bleeding postmenopausally, and some people say, I bleed after intercourse, but then I'm bleeding a lot more over the last couple of months. That'd be another thing. Even if there's a provocation, just any change in that is important. So I'm curious, what is that? That was very comprehensive summary. I understand it as well as I did in fellowship. And what is something that I'm just going to start with Dr. Linton, some other takeaway, either adding to that or something that's just you're really passionate about. I feel the passion for me, Dr. Linton, and I love it. So I'm starting with you. You're going to bleed it into all of us, even though we're all quite saturated, and that's why we're here. Tell me something that we haven't covered.
Okay, so did you know that you can advocate for every woman in this country to obtain Pap test if they're uninsured or underinsured? One way to do that is to be a member of the American Cancer Society Cancer Action Network. Because they have a lobby day every year, and I've been participating with them, where they speak to Congress. We've been doing it virtually for the past 2 years. We talk to our state representatives, like me from Louisiana, and state representative and senators. And we emphasize to them the importance of the breast and cervical cancer program, because this is a national program. And then they have the state part of it that Ms. Crawford talked about. But these programs are on the chopping block every year. So what we do, we advocate for them not to chop it, for them to actually increase funding for that. The other thing too is that we actually go to Baton Rouge during the legislative session, because the Louisiana Tumor Registry is what provides the information regarding cervical cancer and so on, to get the data out to us. And they try to reduce funding for that, as well as for the breast and cervical cancer program. So I'm talking about advocacy. So you can collaborate with others, such as the American Cancer Society, and make sure that we fight for that. And I know, like the nurse practitioners and their other groups, so we can always come together as representatives of the physician group, the Navigator group with the American Cancer Society, or any group that is going to Baton Rouge or to Washington, D.C. to advocate that they do not put us on the cutting block, that they actually increase funding for us. So that's one thing that I wanted to emphasize, because a lot of times when women have abnormal Pap tests, they have to pay for the testing and the additional follow-up. But this program that Ms. Crawford talked about, when they are able to get the Medicaid card, then they don't have to pay for their follow-up care, because that's when we lose a lot of people, when we could have done something like Dr. Smith was saying, that if we can take care of it early, then the survival rate is more than 90%. So the survival rate goes down the worse the cervical cancer is. So we want to make sure that if we miss them in the precancerous phase, that at least we get them in early cancer phase. And
yeah, so it sounds like a pretty long, landing strip to be able to take care of it. So thank you for sharing that. That's American Cancer Society. Take action. What, sorry?
Cancer Action Network. So you can Google ACS Scan, and it's $25 to join for 1 year or however. And then the American Cancer Society, they tend to be in every city. They have offices in every city. So, and the good thing about it is that Google, you can get accurate information from Google. So you can always do American Cancer Society Cancer Action Network. And they've been doing this for years. They're very organized, and they are nonpartisan, which is wonderful, because we are here because it's about the health of people.
Yeah.
Yes.
That's awesome. And they're also pretty cool. They were one of the first national things that wanted me to collaborate with them on TikTok. They have a TikTok, and they asked me this year too to make some content. So they're putting education in fun ways. Ms. Mack, what do you have for us? That's kind of something we haven't touched on that you really want people to hear.
I just really want to emphasize follow-up. If you have an abnormal Pap, we have so many women who come back years later saying, oh, I had an abnormal Pap a few years ago. I never had a repeat Pap, or I didn't show up for the colposcopy. I just really want to emphasize follow-up. If you've been told that you have an abnormal Pap, ask the right question, ask about HPV, ask them to explain it to you in simple terms, and just make sure you follow up. Like we've discussed, this is a preventable disease, and you have to take initiative for your own health, and you have to just make sure you follow up appropriately.
Yeah, it's, I've seen it firsthand, obviously, as a cancer doctor, where sometimes the fear is just easier to say, I'm sure if I haven't heard something, then I don't have it. But that's kind of married with a fear of like, what if it is more serious? I promise you, it's easier to make the call instead of just wondering, and then you spare yourself any kind of, retrospective, like, oh, why didn't I call and ask? Just spare yourself that, make the short-term discomfort. Like we said, there's such a long runway on being able to get on top of it and not make it a major problem beforehand. So we're here to do that. So I'm glad you shared that. Ms. Crawford, anything else with our audience? You've been extremely helpful, and hopefully, I know that people are finding ways now to be able to access and get their PAPs.
Sure. So some things I want to highlight is that the Louisiana Breast and Cervical Health Program not only offers cervical screenings, but they also offer low cost and no cost mammograms for women in Louisiana. And they also have a sister program that's called the Wise Women Program that assesses women's cardiovascular risk factors. So when a woman comes into the clinic, she can get an all-encompassing visit. She can not only get a cervical cancer screening visit, a mammogram, but she can also address any cardiovascular risk factors, whereas she can have a test, basic labs to test for her A1C, have her blood pressure checked. So we focus on the total woman, not just the cervical screening whenever women come into the clinic.
No, that's huge. And, we're learning in medicine that a lot of the things that are symptoms and stuff are identified based on like male symptoms for whatever reason. And they call it atypical for like what's more common in women. So something like a heart attack, you may hear, oh, it's chest tightness and pain and this and that. And we know that it's a little more enigmatic or difficult to localize in women. And that's why they kind of sometimes have more advanced disease. So it can be very subtle, right? Like just a radiation pain, a different side or shortness of breath. And just having that full picture, that peace of mind is really, I think, pretty invaluable as well to say, I feel good. I just, I had a full evaluation. I know what I got to do or what I don't have to do yet. And that feels good. Dr. Smith, what you got for us?
Let me just add that they don't have to take off multiple days to come in to have multiple screenings done. They can just get it all done in one day and don't have to worry about taking off from work, because that's also a barrier to getting screened. I have to take off multiple days to go and have screenings done.
Oh, that's huge. That's extremely convenient. Dr. Smith.
Yeah, so I think the panelists touched on screening and advocacy and follow-up and resources that are available. I think I'd like to highlight prevention. So, cervical cancer worldwide is still the most common type of GYN malignancy, but we have a tool at our fingertips to be able to prevent it. It's not something that we're going to tackle overnight, and cervical cancer is going to be around for a few years to come. But if enough people catch on to the idea that HPV vaccines work, cervical cancer down the line, several years from now, can be something almost nearly eradicated, like polio was many years ago. I mean, that's my hope. I think it's going to take a lot of work to get there, but we should understand that HPV vaccines have been around for many years, over 10 years. I think 2006 was the first time the FDA approved the Gardasil vaccine. It's known to be safe, it's known to be effective, and it works. We're seeing great data from other countries that have really robust vaccination programs in place. They're nearly wiping out cervical cancer. It's terrible when a 26-year-old patient walks into the office with a huge cervical tumor and something that we can treat, but it's tough, and it's a lot of time, and there are complications, and it's costly, and it's uncomfortable. That I really wish that we can get to the point where I don't see that anymore. I like treating cancer, but I don't love to treat cancer. It's unfortunate, and I think with work and with everyone on board, we can hopefully eradicate cervical cancer one day.
Yeah, to think, picture a world where one day you'll say, spent all this money and did this training at Memorial Sloan Kettering for treating this thing called cervical cancer that used to exist back in the 2020s. Like that would be, and that's possible. I mean, that's what's crazy is think about how many, there's just not many cancers we can just make go away in a preventative way. We cure cancers, multiple lymphomas and stuff, even sometimes without chemo, but to prevent it, it's crazy. And I'm proud. It is 78% of people, I think, in Louisiana that do get their Pap Smears. Now that's still low nationally, but if you are somebody, their vaccines, am I correct? It's 70%, 78%. No, they get their Pap Smears. So if you haven't gotten it, just know majority have, and are obviously comfortable in doing so. So, man, I feel very, educated. It's kind of a difficult thing to just slip in when you're having drinks or dinner with your friends or at work talking about whatever it is, especially if it's not medical. But you should try. You should just be like, there's not many cancers that are preventable, and this is one. And it's almost a Jeopardy question. Like, again, liver cancer too can pretty much be non-existent from hepatitis if you have the hepatitis vaccine for that hepatitis. But I feel like we've covered all the bases, but if anyone has any questions, we do have the chat log where you can type it in, and we had a couple of good and challenging ones. And if you have something pressing that's about cancer in general, or female cancer especially, or equity, or being able to access healthcare, we have, like I said, an elite team. I lost sleep about how excited I was about this, to be able to answer those questions.
So I do want to add, there was a question in the chat about contact information. So if you're looking for screening, if you're looking for a wellness exam, you're looking for screening, you can contact our office. We do have 2 providers that do wellness exams. If you have a diagnosis of cervical cancer, we do have 4 GYN oncologists. Dr. Smith is one of them. I work closely with him. Our contact number for our office is 225-216-3006. Again, 225-216-3006. You can contact our office and schedule an appointment if you just need a well woman exam and a Pap smear.
Awesome. And if you could throw that in the chat and just put everyone, and they'd actually be able to record it that way. Let's see. The other hosts, did y'all have any questions or receive anything that people want to know?
I have a comment. Teresa, can I go ahead? Okay, so I'm a representative of the National Cervical Cancer Coalition. So anyone who is out there, I will come and talk to you. If you get a group of ladies together, you do not have to pay me. As you can see, I love to talk about this thing. So I can always come to you in any group. Now we can do it virtually because of the COVID-19. So I can come to you and I can talk to you about cervical cancer prevention, and we can have fun and talk about things that we cannot talk about here.
Oh, there you go. That sounds exciting. I'd love an invite for that one. We do have a question, and it's, does an abnormal Pap put you at a higher risk for developing cancer later on? And once you've received the vaccine, do you ever need it again? I was actually thinking about asking this. So it's 2 questions. One, and I could maybe answer that. If you talk about doing a cancer that's cervical cancer later on, absolutely. If you have an abnormal Pap, the way cancer works in general is it's either a series of mutations or some switches that are once normal go wrong. And that's why you need to go back with colon cancer or breast cancer. If you have those problems, you know that there's something over years that's in the DNA of these cells that make it more likely to be unregulated, to just keep growing when they're not supposed to. So that's a general rule. If you have something that's a pre-cancer or something that's dysplastic, that is something of concern that you want to pay a little bit more attention to. But the second question is, what if you had the vaccine, do you need it again? Because if I recall correctly from medical school and residency, it was not 9 at that time or at some year. And then what if you got the shot that did have, I don't know, whatever it was, 3, 5, 6, do you get the whole shot series again? How does that work?
If you completed the series, whenever it was against 2 strains, then it was against 4 strains, and now it's against 9 strains. If you completed your series previously, then you don't need to switch to a different vaccine or get the vaccine series all over again. If you started the vaccination series before the age of 15 but didn't finish it, then you need to get 1 more dose of the current Gardasil with 9. That's against 9 strains. And there are other sort of treatment ways. So ages 9 to 13 those kids get 2 doses. After that, they get 3 doses. And so the most important part is that you complete the series. So,
but what year, if you got your whole series you completed before, what year did you possibly not get all 9? Or was it always 9?
No, it hasn't always been 9. Dr. Linton, how?
It was 4, and Merck came out with 4, and another company came out with 2. So the 4 is 2 against genital warts and 2 against cervical cancer. And then 9 now is 7 against cervical cancer and 2 against genital warts.
And I think that was within the last 5 years or so.
Oh, for the Gardasil 9?
Right.
Maybe about 3 or 4 years, but the Gardasil 4, that's about maybe since 2005 or 2006.
Yeah.
Because I worked at Lalicamp when they just came out and we were administering those vaccines then.
So what do they do if they completed their series before like 2015, before the 9?
It doesn't matter. The thing about it is that I've done research and I cannot remember which 2, some of them coexisted together. I cannot tell you which ones coexisted, because it's just as with advanced technology. You know, when I started going to school, I had to go into the library. Now the kids who are going to school, they get to sit at home and Google or go in the library virtually. Unfortunately, it's like that with some of the advances, but I do remember conducting research and finding out that although people were vaccinated against 4 strains, 2 for the cervical cancer prevention, there were actually 2 that would prevent you from additional strains. I think it was, I don't remember, 52 or 53 or something like that. But it is what it is, that they do not recommend that you now go back and try to get the Gardasil 9. If you got the 4, you're fine. Yes.
Yeah. And to your point, I think just to further clarify, like sometimes we know 2 different strains cause it, but like they're actually married together. So if you're vaccinated against one, the functionality, like if it's 2 pieces to the puzzle to cause cancer, but you don't have 1 piece of that, then this one, it can't do it on its own, basically. Yeah. So gosh, I appreciate y'all so much. This was like, I was all excited all day, and I'm even just literally goosebumps humbled to be in the presence of so much wisdom and education and community leaders. And especially, I mean, more than anything, humbled that anyone that took the time to listen to this, like, you're a leader, period. You're that knowledge seeking, you care about education, and it's something exemplary. And then, you know, I just hope you really just, you know, radiate that to the people around you, because it's something that's infectious, and it's just so cool that you're here. So I'm gonna go ahead and wrap up. It's been an honor, and then I think I'm gonna toss it to Teresa to kind of close out.
Thank you all so much, Dr. Genesia, Dr. Linton, Ms. Crawford, Ms. Mack, and Dr. Smith. Thank you all so much for your expertise. You all, as community gatekeepers and medical providers, thank you for participating in this discussion and sharing your expertise with everyone. We really appreciate it. Second. Okay, I'm going to share these key takeaways one more time. So I want to emphasize how important it is to get up-to-date and accurate information from credible sources when it comes to cervical cancer screening, detection, and prevention. It's also important to get screened. All women are at risk for cervical cancer. So make sure you make those appointments and get screened. And also prevention. It's important to understand what cervical cancer is, the screening process, and the risk factors associated with cervical cancer. Please understand and remember that early detection saves lives, saves time, saves money and resources. So please make that a priority. This is an example of a one-pager document that we will be sending via email after the webinar concludes. We'll be sending it to all of our panelists and all the attendees. So thank you so much for coming and sharing your time with us. And you can use this one pager to share what you've learned today. And please utilize the resources that we will be sending today, and including this one pager and the recording of this webinar. And it outlines all the facts that we went over. So please use all of these resources. So at this time, I'll bring the director of BCPHE once more to close out our webinar. Ms. Brown.
Thank you so much, Teresa. And again, thank you to each one of our panelists. We truly appreciate your time, and everyone that was here tonight. Such a wealth of information that was shared tonight. I heard our panelists talk about how important Medicaid coverage is to preventative health care. And so I want to remind you of the message that I shared earlier, that if you or someone you know has medical insurance coverage from Medicaid, then you must make sure your information is up to date. This includes your address. If you do not update your information, you may miss out on important letters from Medicaid, and you could could even possibly lose your health insurance coverage, and no one wants that. To update your information, you can visit the self-service portal at mymedicaid.la.gov, or you can call 1-888-342-6207. Before we go, I'd like to thank the staff of the Bureau of Community Partnerships and Health Equity and Bureau of Media and Communications for executing such a needed conversation. A huge thanks goes out to the entire Louisiana Department of Health team. And last but certainly not least, a special thank you to the Secretary of the Department of Health, Dr. Courtney Ann Phillips. Due to technology difficulties, we were unable to hear from her, but her presence and support was noticed and much appreciated. And so is her continued leadership in pursuing a healthier Louisiana. With that, we're going to conclude our webinar tonight. Thank you so much for attending, and you all have a great evening. Oh, someone asked for the Medicaid number again, 1-888-342-6207. Thank you all so much. Have a good evening.